Hello and welcome back to Nolan Financial Radio. My name is Tara Nolan from Nolan Financial. And if you're new to the show, I just want to tell you this is all about education. So if you have a question as we're going through, please feel free to give Chris and I a call at 719-210-4242. And also to visit us online at www.taraenolan.com. While you're there, go to the radio page and you can click on it and you can see a lot of past shows. We do a lot of educational topics from Medicare to IRAs to 401ks, kind of a lot of different topics because it all starts with being able to ask good questions. So, and while you're there, you can actually subscribe on Apple Podcasts or Spotify so that way you can get notifications about the shows as they come. So anyway, please don't hesitate to reach out to Chris and I with questions or to set up a face-to-face or virtual meeting. So today we're going to talk about, can you possibly save money on healthcare? And this is one of the biggest things that we have to plan around because everybody needs healthcare, and healthcare is wildly expensive and just unpredictable. We don't have that transparency in the program yet. So today what we want to try to do is give you some tips because you got to have it. So if there's any way that you can cut some corners or get it a little bit better, we want to help you do that because it'll make a difference in your financial plan. And anything you save on healthcare becomes money that you can invest somewhere else. So that's always a good thing. But before we jump into the radio show, I wanted to touch base with my amazing co-host, Tony Shore. Tony, how are you doing today?
Well, I'm doing great, Tara. I've had a really good weekend and just been doing good. Last week, so busy. And, that keeps me out of trouble. So we finally got some rain and that was good. But yeah, I've just been keeping busy. How about you? What's going on over there?
So we've been lucky, like with our country's having this heat wave, and it's been pretty bearable here. And I'm having some family visit right now, so that's nice. And getting to do that. It's nice that we're starting to be able to travel a little bit more and kind of hopefully keep getting back to normal. Got vaccinated, so I feel pretty good about getting out in the world.
Yeah. And my whole family, we've been fully vaccinated now for a bit. And we got it kind of early because my wife works in healthcare. My wife, my daughter, and my son all work in healthcare right now. At least, my kids work for the summer as CNAs for an assisted living center. And my wife works for a healthcare related company. So we got our vax, and that's really good. We're fully vaxxed and ready for the summer. So that's good. And I hope everybody out there stays safe. And it seems like we're coming out of it. Hopefully, we do still need to be diligent, but I'm looking forward to this topic. I mean, we're talking about healthcare today, so it kind of ties right in, Tara. And how's Chris doing? Are you keeping Chris in line? Is he?
As much as you can.
Yeah. Well, I know he does a lot of the legwork and is meeting with a lot of people, a lot of listeners who call in and have questions. I know Chris talks to them a lot. You've been busy working on your book, and can't wait to read that. That's going to be exciting. And I know our listeners, there'll be some offers for them coming up. So beginning of next year, right?
January 25th is what we're shooting for now.
Excellent. Well, I've read some snippets, and it's just amazing so far. So I have nothing but great things to say. I'm excited, so we can talk about it on the air once it comes out. But regarding healthcare, I mean, I think you spelled it out really well. With things like people get the latest gadget or a new suit, you generally can come up with a way to plan for it or get it at a better price. People find discounts. If we're going to get something like that or a new computer, we always find a sale or a coupon. But with healthcare, it's different. It's not like these healthcare insurance companies offer Groupons.
Right.
Or there's not a flyer in the Sunday paper with a coupon in it for, a discount off healthcare, Blue Cross Blue Shield, buy one plan, get one 50% off. There's no BOGO deals with healthcare or broken limbs, nothing like that. So, obviously, I think our audience, as well as myself, we're going to be listening close today.
So, excellent, Tony. And so, one of the things I believe in is continuing education all the time. And so I came across this great article in Kiplinger called 20 Ways to Save on Healthcare. And I wanted to share that with everybody because, it's just all about every little bit of positive traction you can get when it comes to creating your finances helps. And so I know for folks listening today, one of these tips may help you. So it's pretty exciting. So one of the things that's interesting is this article is that even if your employer picks up a sizable chunk of your healthcare costs, you're still likely to be forking over thousands of dollars every year. Healthcare is expensive. I think one of my clients said it's my condo without a roof.
I love that. Yeah. I don't love it, but it is so true. Healthcare is outrageous.
It is. And so according to the Kaiser Family Foundation, workers who have employer provided healthcare, this is employer provided, still pay about $1,200 a year for single coverage premiums. And then family coverage, it's up almost like $6,000, $5,500. So
or more in some cases.
Right.
I know that a good family plan, if you want a low deductible, it's going to be about $12,000 a year through companies I've worked for in the past and people I've talked to recently who work for medium-sized companies. It's a lot of money still, even with the company covering a lot of the costs. And
then you just touched on it is then you think you have good healthcare in play. And then sometimes you still have large deductibles.
Yeah.
It can be almost $2,000.
Yep. So, most have huge deductibles. And in order to pay for it, you still have to be putting your own money into an HSA on top of the premiums.
Right.
So, yeah.
So it's really expensive. So we always want to try to look at it. So one of the first simple ways that you can try to keep your healthcare costs under control a little bit is to try to make sure that you do stay in your plan's network. And I'm having to learn this as a military person because I've just gone to the military hospitals and you just kind of go and see who you get. But it's interesting that once you start to get these networks, if you stay in your network, it is a little cheaper. And I can tell you, especially for us, Tony, with dental care, that's where I've noticed a big difference. Like I think Chris needed to have a root canal and we wanted to go to this one dentist, but then it turned out he wasn't in our network and it was going to be twice as expensive.
Yep.
And so there's little things like that where, unless there's a real good reason why you want to see someone outside your network, then try to stay within your network. So that's the thing that can help.
Yeah, and that's been a real problem, Tara. I've seen some news articles on this, and people have complained so much that I think there's some pending legislation to deal with that situation that may offer, if it passes, some degree of future relief. Is that correct?
Well, hopefully, Tony, because beginning in 2022, the federal law is supposed to dictate that insurers are going to provide in-care network rates on the surprise medical bills. Because what happens if you unknowingly get emergency care from a provider outside their network? And Tony, I can tell you that happened to me. So when I was down in Florida with the horses about 4 years ago,
That's right.
I broke my ankle and it was broken, like it was turned completely sideways. So no one would even touch me. Like no one would bring me to the hospital because they're like, we're not touching that. So I had to get an ambulance. Ambulance ride was $3,000. And then you just go to the emergency room.
I would have given you a ride to the hospital for $300.
No one would touch it. They were like, no, because they didn't. And I don't blame them because you don't want to.
No,
it was hanging off. It was not. I looked at it once. I'm like, oh, I'm not looking at that. But so then you go to the ER and you got to get that fixed. Like that's not optional. Right. And so the surgeon that was on call came down because they had to straighten it out because apparently they were like, why aren't you screaming? And I'm like, it doesn't hurt. And they're like, oh, that's not good. Because apparently it was cutting off the nerves and the blood flow. So they had to fix it. And it turned out that surgeon, though, he wasn't in my network. So after they kind of got it stabilized, I had to spend the next couple of days. And Chris wasn't in Florida with me. So he was doing this remotely from across the country, trying to find a surgeon that was in my network so that I could get the surgery that I needed to have.
Oh, no.
And I'm just like, thank goodness. I mean, and thank goodness that we were both two adults and we didn't have like kids to worry about. And so I just can't even imagine like for families. I mean, this was hard enough for us, but we were two capable people. Can you imagine for someone who's trying to juggle kids and because you know how it is. Yeah. The wait time will be 2 hours.
Yeah. Yeah, it's insane. And so, yeah, the healthcare system, I mean, it's no news to our listeners out there that it's frustrating and messed up and expensive. However, the in-network thing, like you said, just emergency procedures and emergency room visits and ambulance rides, that there should be no such thing as out of network for emergency room visits and emergency procedures if you have an accident. It just shouldn't apply. And so I'm glad they're at least trying to get that fixed and changed. 2022 can come fast enough for that for a lot of us,
That, and then hopefully, I mean, because emergency is one thing, but then the thing that really bites is when you get an unexpected bill and it wasn't an emergency. And
Right.
because what you don't want to get caught is that situation where you could have made a different choice.
Yes. Well, I know. Yeah. And that's happened. I know people, I've heard the horror stories, and, it's not a surprise. It sounds more like a kick in the teeth, Tara. Right? Which is also
Well, unfortunately, it just reminds me of like taxes. It's like whoever knows the most rules wins.
Yep, exactly. So what's next? What's another way?
Right. So the next thing that you can try to do is a lot of these healthcare systems are getting smart that preventative healthcare works. So, how the doctor always used to say, have you eaten your vegetables? Are you eating are you exercising?
Sure.
Because preventative care works. And so there's a lot of plans that actually will have preventative care services that they'll provide without sending you a bill, even if you haven't hit your deductible. So some of these things can include, let me give some examples because you're probably listening and going, well, what would that be? And so some of the things can be like immunizations, screenings for depression, blood pressure, cholesterol, diabetes. And, if you have certain risk factors, like mammograms are also offered as well, because what they've learned is just statistically, if you catch things early, it's a lot cheaper. They're not doing the goodness of their hearts, but they go, hey, if we catch these problems early, then we can treat them and that'll work for all of us. So it's one place that for the listeners, Tony, is that they can go to healthcare.gov and search for preventative care benefits. Then that will let them research some of the things that they may have that they didn't even know. Because I bet a lot of people, if they're like me, like I have no idea what preventative care benefits I may have. So I'm going to actually do that myself. Because you'll see there's like a lot of services that can be broken down for adults, for women, for children. And preventative care services, they do come at no cost if they're provided by a doctor in your network. So you just want to check and see, because you don't want to miss out on something that's already available. You just didn't know.
No, right. Exactly. And so actually, Tara, let's give that website one more time. It's healthcare.gov. That's healthcare.gov. And then you search for preventative care benefits. And I think ultimately, like you say, preventative care might not only save you a few bucks, but it might also prevent or slow down some of the medical conditions that can negatively affect you later, like physical activities, things that make retirement so much fun. So you want to prevent those issues so you can enjoy your retirement eventually. Now, we should probably take this time to let our listeners know if they have questions about this or want to make sure that their overall financial strategy includes healthcare costs. How can they get a hold of you?
Sure, Tony. So people can call Chris and I at 719-210-4242. That's 719-210-4242. And definitely give Chris and I a call if you haven't really understood, like your financial plan is holistic. And so it's not just about your 401k or your emergency fund or your IRA. Healthcare is actually a big part of it, because when we look at your financial plan, we want to grow the money, but we also look at protecting you from those things that will suck your money away, like an unexpected healthcare expense. And so part of a good financial plan is growing your IRAs, growing your 401ks, but you also have to have a defensive part of your plan that protects you from those unexpected emergencies, because an unexpected $200,000 bill can really set you back in terms of your planning and your growth and your compounding. So please give Chris and I a call if you're wanting to make sure that you're looking at, is healthcare included in your holistic plan? And Tony, that number is 719-210-4242.
All right. Well, thanks, Tara. And let's keep it rolling with this topic. You've been talking about some of the ways that we can save money on our healthcare, which is Wow, who doesn't want to save money on healthcare? But you also need to ensure that you have all the services you need. And I think it's been a good discussion so far. So, what do you have for us next?
So this next one I'm actually a big fan of is, because of the pandemic, we started doing video or telephone consults with doctors. And that started to become, it's called telehealthcare services. And it started to become a lot more popular. And a lot of times if your insurance provider covers that, you can get a telehealth service, basically speaking to a professional on the phone. And sometimes it'll cost less than actually going to do an office visit. And like for me, Tony, I get a sinus infection a couple times a year. I know the symptoms, I know what happens, and I just need a prescription for antibiotics. I don't need to go sit at a doctor's office and go through that whole process to have someone go, "Oh, you need some antibiotics."
Yeah, exactly. Yeah.
So for me, that's like a dream to go, okay, I just need a prescription. I always like when I'm traveling, like in Mexico, I can just go buy antibiotics at the pharmacy.
Right.
But
exactly.
here you can't. So for things like that you need to have, or cough syrup or, basics, a refill on your nasal spray or something for your allergies. Those are things that it's worth looking into, because if you can do that just over the phone, that can save you not only money, but a lot of time.
Yeah. Yeah, it can. And I just think that, when we look at things like that, Tara, it's so important to understand how it works and what's covered. And I think more and more of the insurance plans out there are offering that. My wife and I, we have 3 kids, we have used that and we take advantage of that. I wish we had that when the kids were little, because so often, it's like, okay, they have an ear infection or a sore throat. And I know that antibiotics would probably knock it out. But do you want to go to the clinic where there's a room full of sick people, and you're already worried about getting sick yourself because you can't take care of it's not being selfish. How can you take care of your kids and work at your job to provide for your children if you get sick? And so that's always fun, right? Mm-hmm. Going to the clinic, I think, is just if you can avoid that and it's something simple, you got to do it. And I'm sure that some of our listeners today would probably think a virtual medical appointment might be cumbersome from a technology standpoint. Maybe if you're a little older or don't like technology, but the reality is it's actually pretty user friendly.
It's pretty user friendly, and and there's a lot of people today that are good with computers, and good with their phones. So even if just the people that are very happy with technology use it, it saves. And I can tell you, I'm still the old school person where I want to talk to a person, and Chris is, if at all possible, if he can just get online and do it without talking to anybody, that's where he's at.
Yeah, I have to talk to somebody in person. I'm old school.
That's my preference. I don't like to think I'm old enough to say I'm old school.
You're not. You're still old school.
But what was I saying? I said the other day I was talking to some of my airmen and I used the word awesome, and they were like, "Yeah, nobody says that anymore."
I say it all the time. What? I'm not supposed to be saying that? I use the word awesome all the time.
You're self-identifying with me.
You know what our sound editor Mitch would say to me? He'd say, "Okay, boomer." Even though I'm not a boomer, I'm too young to be a boomer. Those are my parents. But so what's next?
So one of the things that we've talked about a lot on the shows is, like with your 401k, you want to take advantage of that matching, right?
Yep.
And it's not our topic today, but I'll foot stomp that again. Make sure you're taking advantage of your matching with your 401k. Yeah. But one of the things really interesting with healthcare is that sometimes with these health savings accounts or these flexible spending accounts, some employers will do matching for those.
Wow. And that's awesome. If you do have an employer, maybe some big companies do that. And I think that would be amazing.
And it goes back to that preventative health thing. So you just want to be aware that your employers, they're only going to match your contribution, which makes sense, right? They're not going to do more than you're doing, but just you want to find out and ask that question if that's a benefit that you have. Because there's these things like that, the company might think they've informed you and sent you something in the junk mail, or it might have been in a stack that you may or may not know. So it's just great to ask the question. And that could be a phone call that might just save you a little bit.
Yeah. Yeah, that could be a lot, and there are discounts too. Some companies get incentivize the programs, their healthcare, with breaks on monthly premiums for things like gym memberships and doing things like that. I mean, if you're a smoker, your company might offer free access to a program to help you quit. Take advantage of that, and that's a way to save on healthcare. And you might get a break on your premiums even for participating in that program to quit smoking, and that's a win-win right there.
Absolutely. Yeah. And obviously, if you can quit smoking, that's always a great thing.
Yes.
So the next thing that I mentioned, so we talked a little bit about health savings accounts, but let's go into just a little bit more detail. So more commonly referred to as HSAs, the health savings accounts potentially can be an excellent way to save more on your health care. Because if you have a high deductible plan, and like in 2021, you were allowed to actually contribute $3,600 for self coverage and $7,200 with a family plan. And then if you're 55 or older, kind of like the same thought process, you can actually do $1,000 catch-up contributions. And so, but here's why this matters is HSAs are funded with pre-tax dollars. So that means you get to deduct that. And then that money will grow tax deferred. And then you can withdraw the money as needed for medical expenses. So, we talk about having your money do more than one thing instead of just having money sitting in your bank account, earning little to no interest. If you can put it in an HSA, you get to have that money grow tax deferred. So you get a tax advantage. And then the money's there when you're going to need it for your family. So that's another potential way that we can look at. I like to talk about in the book, I'm talking about this a lot, Tony, is how do you leverage your money so it's doing more than one job? Money sitting in a bank account is just there earning maybe little to no interest.
You got to make it work for you.
If you can take that same money and maybe put it in an HSA, so you're going to get a little tax benefit, you're still going to have the money available to do the job it needs to do. But that way it's doing more than just one thing sitting in your bank account.
Yeah.
So this idea of leveraging your money is something I really want people to start to think about and understand.
Well, that's great, Terry, and that's a great point. HSAs are a great way for people to do that, really leverage their money and save on healthcare. Now, along those same lines, flexible spending accounts, right? They're somewhat similar, and they get a lot of attention when it comes to healthcare planning as well, right?
They're another tool, a lot of times through your employer, so that you can contribute up to about $2,700 in pre-tax dollars and then withdraw the money for certain medical expenses. So here's the thing, Tony, with all these benefits, anytime you're getting a tax benefit, there's always going to be some caveats, right? So You just got to make sure that you understand what the rules are. And again, it goes back to that. Whoever knows the most rules wins. So if the government's going to give you a break on taxes, there's going to be some rules to follow. So just make sure you understand what those are. But for some people, the FSA funds, they can use them for child or elderly care. And some of those limits may be different. But if you're using it for medical expenses, right now the limit's $2,700. But ultimately, you can withdraw HSA or FSA flexible money tax-free to cover deductibles, copays, and insurance. And that's a huge deal if you can put money away and get a tax break. And then with the certain things that it qualifies for, you can pull that money out tax-free. That's way better than just having it sit in your bank account.
Yeah.
And the cool thing is some of these accounts can be used for things like eyeglasses, medical monitoring equipment, testing devices, and some orthodontic work. So you just want to make sure that you look at the rules, because especially if you have a family, right? You don't ever know what the emergency is going to be, but there's going to be something.
Yeah. There's always something, right? Yeah.
Always.
Yeah. Yeah, especially if you have kids, but even if you don't, there's always something. And, your healthcare strategy is a huge part of your financial and retirement strategy. It needs to be. And I'd certainly urge anyone listening out there, and this isn't a sales pitch. This is just part of the advice we offer on the show. You have to work with a financial services professional who's going to be able to look at what you have for healthcare coverage and look at the costs for healthcare and determine how it's going to fit into your overall financial strategy. Right. And Absolutely. So it's just another important part, especially as you get older and start retirement planning. And I know you do a lot of retirement income planning for people, Tara, and you have to look at, okay, how are you going to pay for healthcare until you hit 65? And then after you hit 65, we have to look at what Medicare covers and doesn't cover. And I know these are things that you and Chris have helped your clients out with. So if any of our listeners have questions about this, they need to pick up the phone and give you guys a call. And then you'll need to have a sit down with them. And there's no cost for that initial consultation. Just your time. There's no charge. And I think that's really important, isn't it?
It is, Tony. And I like that you brought it up, because one of the big things we help a lot of people with when they come into the office is they have the situation where the primary breadwinner, usually the husband, is retiring and getting on Medicare, but the wife is younger. So there's this gap where when he retires, they don't have the company coverage anymore for healthcare. So then they have to figure out how they're going to have healthcare for a spouse that may not reach Medicare age for a few years. And so that becomes a big thing we have to plan for retirement to make sure it's successful, because that can be an expense that you weren't ever used to having.
Yeah.
And so we want to, like I said, medical expenses are one of the biggest things that people forget about as the defensive part of the financial plan, because we're all focused on the growth phase. You think of that bell curve and the money growing, and that's good, but then you got to have some defensive things in your plan to make sure that your plan doesn't get torpedoed unexpectedly.
Right.
And that's what we want to look at. But one of the things about HSAs that's nice is they don't expire. So I'm a big fan of strategies, Tony, where you can put your money away, and then if you don't need it for that thing, you get to keep it. And let me explain that for a minute, because I think it's a really important concept. Like, let's think about car insurance. If you pay your car insurance and you have a great year and you don't get in an accident, do they give you all your premiums back?
No,
that money's just gone. Like, you might have some companies like USAA that will give you some money back, but they don't give you all your money back.
No.
So we try to stay away from those kinds of things. But one of the things, like as an HSA, is if you can put your money in and then you don't need it, the money is still going to be there. And that's important, because there's nothing worse than put your money in and then it's just gone. And we have to have car insurance, but that's some of the strategies that we want to look at is how do you pay for a defensive thing you need in your financial plan. But then if you don't end up needing it, like long-term care is another great example of, do you want a policy that's you have to pay every year? And then if you don't get sick, oh, well, you don't get your money back. Or do you want to set up some kind of coverage that if you don't get sick, then you can still use that money?
Yeah.
So
yeah, and that's huge right there. And you mentioned, I'm glad you brought that up. HSA funds don't expire, and that's good. You reminded me of that. And then I've learned the hard way that flex spending accounts do typically expire. So the good news is you can have money in an HSA account and keep it. It's yours, even if you leave a company. The money you put in is yours and stays with you, and you can keep that account going or keep that money for when you need it. A flex spending account doesn't work that same way, does it?
No. But then that's just why it's so important that you meet with your financial planner regular, Tony, at least once a year, because the rules change.
Yeah, they do.
So what worked this year may change next year. And that's why your financial plan is like a living document. It's like not something you do once and forget about it. It's like, hey, let's look at it and see, did anything change? Do we need to update it? So it's a living plan.
Yeah. Well, Tara, the show just flew by. We're out of time already.
Oh,
is
boy.
Is there anything else you want to add for our listeners before we go today?
Well, Tony, I mean, the biggest takeaway from today's show is setting yourself up for success, because the thing is you are now responsible for your own retirement. It didn't used to be that way. There's not very many pensions out there anymore. A lot of people have 401ks, and building that good plan means definitely having a plan for your healthcare, because you got to have healthcare. It's not optional.
Nope.
So we want to make sure that is part of your holistic financial plan. So for people listening today, if you don't know how healthcare is part of your holistic financial plan, give Chris and I a call at 719-210-4242. Because Tony, we don't just look at the growth of your accounts. We also look at how you protect the accounts, because it's holistic and it has to go together. So Tony, that number is 719-210-4242. For those folks that want to have the best plan possible for their success.
Yeah. Yeah, that's important. Well, Tara, great show today. And listeners, that does it for today's episode of Nolan Financial Radio with our great host, Tara Nolan.
Join us again for Nolan Financial Radio. Take care, and we'll talk with you next time.